I've been in the rare disease community, in the rare disease world for since 2016. In 2016, my then 2-year-old daughter Susannah was diagnosed with a very rare genetic disorder, a mutation in her KIF1A gene. So COVID-19 is impacting, our day-to-day in two very specific ways, right? Of course, there's the anxiety and the challenges that everybody's facing. But immediately the effect that we're feeling is the school closures. So living in New York City when the public school system closed, it seems that there was one thing and one element and one group that was sort of forgotten about when it came to coming up with a mitigating plan. And that's kids who had IEPs and kids who have significant therapies that happen during the day. So Susannah gets, about 20 to 25 therapies a week, and those providers are at school, and when we have, she needs these therapies, and kids like her, kids with diseases similar to KIF1A, need to maintain those therapies in order to not lose skills, right? So if she stops having her physical therapy, she's going to lose steps. If she stops having her speech therapy, she's going to lose words. So, that was an immediate challenge we saw was, okay, so we're home. We know how to deal with a kid who has a compromised immune system because she does. So that navigating that, keeping things clean and being aware of, not going out and sharing germs with the world was, and I know it's far more significant than that, but was something that was a little bit easier than having to figure out how we're going to make sure that she doesn't miss a therapy at all. So that's what we're doing day to day, working with those therapists. But, there's no social distancing kind of ruins physical therapy that needs to be handled. The major concern I have right now is there's the ventilator allocation guidelines that each state has. So there are several states that those guidelines are archaic, 5-10 years old. They were written, a long time ago, specifically for pandemic situations. But and those guidelines are a scoring system that will get used if there is a horrible pandemic which we're facing, where people aren't getting access to ventilators because there's a shortage. So what those guidelines are is a way for clinical assessment and prioritization of who gets those. And there's several states that the exclusion criteria for ventilator allocation is untreatable neuromuscular disorders, right? And so that touches a lot of rare diseases, right? And I think that it's really important to know that and to sort of scream from the mountaintop right now that, hey, listen, first of all, the fact that the language untreatable is used at all is unacceptable, because in the New York State guidelines were written 5 years ago, right? In the last 5 years, there have been therapeutics discovered for SMA. There have been, we have figured out therapeutic modalities to address every single disease. So the fact that there are, these emergency guidelines that aren't updated to reflect the needs of the rare disease community is criminal and needs to be reevaluated and rewritten before it gets to the point where our kids with, neuromuscular disorders or disorders that could be disqualifying on those exclusion criteria prevent them from life-saving measures. So that's something I'm really scared about. We need to stay home. That's it. I mean, it's that simple. As if everybody stays home, you're going to be able to focus more and you're going to be able to stay healthy, right? So I also want the general community to know that there is an entire army of people who do this every day, who wake up every single day and are committed to fighting rare and unknown diseases. And figuring out how to mitigate not just the challenges about medical challenges and research challenges, but the every single day life challenges, right? So if people are trying to figure out how to function and stay indoors, well, you know what? There are tons of rare disease communities out there who live indoors because they're compromised immune systems or because they have anxiety disorders or depression. It doesn't matter what it is. There are communities that exist in our world who face these challenges and have found out and know strategies to make sure they're done in a way that is safe and in a way that is not isolating and debilitating. So what I would say to the general public and to everybody is to stop and look at the rare disease community as a model in how to face the challenges that we're now facing as a society as a whole, right? So it's look to the rare disease community for guidance and as a model of how to do things, fast, how to do things thoroughly, and how to do things that are teeming with integrity and teeming with grit, because every single member of the rare disease community knows what it's like to roll your sleeves up and to go out and do whatever we have to do to keep our kids and our family healthy.